You know, in healthcare, there's a saying, what gets measured gets managed. But here's the real question. Are hospitals measuring the right things? Today, we're going to cut through all the noise and pinpoint the 10 most critical quality indicators that are truly essential for improving patient safety and driving excellence in hospitals across India.
I mean, this is the core of it, right? So many hospitals are just drowning in data. But is it the right data? Are they tracking the metrics that actually tell you if a patient is going to get better? Or are they just ticking boxes for paperwork? The difference isn't just about compliance, It's literally about saving lives.
This quote just says it all. The stakes have never been higher. High quality, safe care isn't a nice to have anymore. It's the absolute bare minimum that every single patient walking through those doors deserves.
So let's talk about that quality challenge. Hospitals all over India are under some serious pressure. And it's not just from patients who, rightly, are demanding better care. It's also coming from national bodies like NABH, that's the National Accreditation Board for Hospitals, and standards like NQAS. The message from every direction is crystal clear. You have to prove you are safe, you are effective, and you are efficient.
Okay, so to meet that challenge, hospitals need the right tools in their toolkit. And that brings us right to the heart of what we're talking about today, decoding what these quality indicators actually are and why they're so incredibly powerful.
The easiest way to think about a quality indicator is as a hospital's report card. It's a single, measurable piece of data, a number that shows you exactly how a hospital is performing on safety, on effectiveness, and on efficiency. It's the key to seeing where you stand and, more importantly, where you can get better.
Now, these indicators aren't all the same. They generally fall into 4 big buckets. You've got your clinical indicators, which are all about health outcomes. Then there are operational indicators, which measure how smoothly the hospital is running. You also have patient experience indicators, capturing the human side of care. And finally, safety indicators, which track and help prevent things from going wrong.
All right, now for the main event. We're going to walk through the top 10 indicators that, together, paint a really complete picture of a hospital's performance. Let's start with a really critical one for safety. First up, the surgical site infection rate, or SSI. It's pretty straightforward. What percentage of patients get an infection right where they had surgery? Now, in the Indian context, this is a massive deal. Research shows that SSI rates here can be higher than in many high-income countries, which makes tracking and reducing this number an absolute top priority for surgical safety.
Building right on that, our second indicator is hospital-acquired infections. These are the infections a patient gets during their stay, not the ones they came in with. This metric is a direct reflection of the basics, like hospital hygiene and, you guessed it, hand washing. And while surveys might show a 77% compliance rate for hand hygiene, the data also makes it clear that we need much stricter monitoring, especially in high-risk places like the ICU.
Our third indicator is a huge red flag: unplanned returns to the operating theater. Think about it. If a patient has to be rushed back for a second emergency surgery, it probably points to an issue with the first one or maybe the care right after. Studies in Indian hospitals show this happens in about 1 to 2% of cases, often due to preventable things like bleeding after the operation.
Okay, let's shift gears from purely clinical to operational metrics. Here we have the average length of stay. In simple terms, how long is a patient staying in the hospital? See, a longer than necessary stay can point to bottlenecks in the system, things like delays in getting test results or holdups in discharge planning. For Indian hospitals, this is a crucial metric for managing both costs and making sure beds are available for new patients.
Number 5 is the bed occupancy rate, and this one is a real balancing act. If your rate is over 90%, it might look great on a spreadsheet, but it probably means your staff and resources are stretched to the absolute breaking point. But on the other hand, if your rate is below 70%, you're not being very efficient. That sweet spot is right around 85%, a sign that a hospital is busy but still has things under control.
A hospital's job doesn't stop the moment a patient walks out the door. That's why the readmission rate is so incredibly important. It tracks patients who end up coming back within 30 days. This is a huge indicator of how good the discharge planning and follow-up care really were. While tracking this is still a developing area in India, you can be sure the best hospitals are watching this metric like a hawk.
Next up is, well, arguably the ultimate clinical indicator, the mortality rate. But it's not as simple as just counting deaths. The real gold standard is the standardized mortality ratio, or SMR. This is a much smarter metric
because it adjusts for how sick the patients were when they first came in. And this is critical. This kind of risk adjustment isn't done consistently in India, which means there's a massive opportunity to get a much more accurate picture of care quality.
Indicator number 8 moves us away from cold, hard data and into the human experience. As this quote shows so perfectly, patient satisfaction isn't about how nice the rooms are. It's about fundamental questions. Did I feel heard? Was I treated with dignity and respect? These things are every bit as vital as the medical treatment itself for building trust and getting a great outcome.
A truly safe hospital is one that learns from its mistakes and its near misses. And that's the whole idea behind tracking operational safety incidents. We're talking everything from a patient fall to a medication error. The goal here is never to point fingers, but to find the root cause and build better, safer systems to prevent it from happening again. This kind of proactive safety culture is a huge part of NABH accreditation.
And rounding out our top 10 is laboratory turnaround time. Just think about how many treatment decisions depend on getting fast, accurate lab results. A delay in the lab can mean a critical delay in care for the patient. That is why NQAS-accredited hospitals are obsessed with this metric, because in medicine, time is everything.
Now, of course, tracking all of this stuff is way easier said than done. We have to be realistic about the hurdles that hospitals face on the ground, especially within India's incredibly diverse and complex healthcare system.
And these hurdles are pretty significant. A lot of data collection is still done manually, by hand, which is just asking for errors. Getting those complex calculations for things like risk adjustment right is a huge technical challenge. Even something that sounds simple, like following up with a patient after they go home, can be incredibly hard to do consistently. And just keeping this effort going day after day requires a massive commitment.
So, knowing all those challenges, what's the path forward? Look, it's not about being perfect overnight. It's about building a solid, sustainable framework for getting a little bit better every single day. The way forward can really be broken down into 5 key steps. It all starts with building a balanced dashboard that looks at everything from clinical results to patient feedback. Second, use technology to automate data collection whenever you can. Third, you have to actively involve patients in this process. Fourth, create a culture of continuous improvement where everyone is always learning. And finally, benchmark everything you do against national standards so you know exactly where you stand.
And that brings us right back to where we started. Monitoring quality isn't just an exercise in compliance. It is the absolute foundation of safer, more efficient, and more compassionate healthcare. So the question for everyone is, are you measuring what truly matters? Because the right data, it doesn't just create better hospitals, it saves lives.